So let's jump in. I'm excited to see you both here today. Gretchen, could you please go ahead and introduce yourself to our audience, those who are not familiar with you? What do you do? Who are you? How did you get started?
Yes. Well, first of all, thank you for having me here. I'm really excited to be able to chat with everyone and hopefully answer any questions that you guys have. So I'm Gretchen Hawley. I'm a doctor of physical therapy and a multiple sclerosis certified specialist, which is always a mouthful. I feel like I have to say it slow to get all those words in. So basically what that means is I'm a physical therapist who has additional training and certifications specifically for multiple sclerosis, which is really cool because working with exercises for multiple sclerosis is completely different than it is for regular orthopedic physical therapy. So things like back pain, knee surgery, neck pain, shoulder, all that stuff. So you have to approach it very differently. And that's what I do as an MS certified specialist. So sorry if you can hear the dogs barking.
Oh, that's
Um,
all good. We love dogs.
um, let's see, probably about nine years ago is when I became an MS specialist, and 6 years ago is when I started focusing more online. Because I don't know about you guys, we're all online right now, which is really cool. We are probably all over the world realistically, and I was finding that so many of my patients couldn't get to me because they were too far away. And if they couldn't get to me in the clinic, that meant that I couldn't help them. So I started sharing my expertise on social media and I started an online program. So now I almost exclusively work with my clients virtually. There's still a little bit that I do in person, but I share all of my MS specific exercises and tips and strategies online. So that's a
That's
brief recap.
that's awesome. And do people need like a doctor's referral to see you, or can they just go to your website and discover you and reach out to you? How's that work?
Yep, no doctor's referral needed. It's mostly educational based content. So even though I'm a physical therapist, it's not evaluating, diagnosing, and treating individually. And so you don't need a doctor's note or anything like that. Some insurance companies do cover it if they cover online programs, which more and more are covering that. So it should be pretty easy to access. There's lots of different options, but it's all on my website.
Awesome. Also, welcome Tyler Susko, our founder. For those of you that are new, Tyler founded the company and invented the shoe. Tyler, do you want to do a quick intro about yourself?
Sure. Thanks, Johannes. Can you hear me okay? All
Absolutely.
right,
Loud and
great.
clear.
So, hi everybody. My name is Tyler Susko. I got exposed to the world of rehabilitation devices when I was doing my PhD at MIT. I was working on robots at the time, so robots that administered physical therapy to people, specifically walking therapy. And I was doing this with a big robotic system that was capable of removing the floor when people would go forward for a step. So as soon as someone would take another step, the treadmill on one side of the body would fall away, allowing that foot to come back forward. And as they were about to heel strike and take that next stride, the treadmill would come up and meet their foot again and take it back. One of the things that came out of my studies at MIT was just that it was really a lot easier for people to walk when they didn't have to worry about their foot coming in contact with the floor, because the floor was effectively being removed when they were in swing phase of walking and moving that foot forward. And one person just joked with me and she said, boy, I wish I could just have that feeling when I walked outside of your lab. And so that started to get my mind turning. At the time, I left MIT and I joined UC Santa Barbara, where I am currently. And we started down the path of trying to develop out the same feeling that people were having on that robotic treadmill, but something that was overground and accessible to a lot of people. So it started with robotic shoes, and then there were all kind of problems with robotic shoes. There was weight concerns, software malfunction, water getting in, all that kind of stuff. So we transitioned into something that I called more passive, which means there were no motors or electronics involved, and we got to this Cadense original shoe that you've all seen on the website now, which just uses differences in foam density instead of any type of electronics or motors. So that's how Cadense came to be, and we're lucky to have Johannes now leading the company and helping us to offer these shoes to the world.
Awesome. Thank you for that intro. Gretchen, it's been, I want to say half a year? No, 9 months since we first started talking about this. What were sort of your first impressions when you saw the shoe and when we started talking about it?
Yeah, I'm always a skeptic when it comes to products, especially when they promise something as good as what Cadence does, which is a huge symptom of multiple sclerosis with drop foot or foot drop. That is something that I would say 90%, if not more, of my clients struggle with. And so, but when I first heard about what it was, without even looking into it, I was a little skeptical. But then I looked into it and I went to the website and learned all about it. And then I was like, okay, I could see how this could work. And then I hopped on a call with you guys to hear actually how it worked and all the different specs about it. And then you guys had sent me a pair of shoes, so I actually got to try it. And as soon as I tried it, I was on board because it's again, it's such a common symptom. And as of right now, there's nothing else that I know of that can actually help in the same way that Cadense Shoes does. So at first I was a little skeptical, but as soon as I tried them on and saw where the pucks were placed and how these were meant to be used, I was on board right away.
That's amazing. What have your experiences been so far? I know that some of your clients have purchased them, tried them. What's been the response, and do you actually use it in your sessions and all kind of stuff?
Yeah, so I posted a social media post about it not too long ago, and so many people got the shoes from that. And my clients in my program, a bunch of them got them, which has been cool because we've kind of been talking in our accountability group about it. And the general consensus is that they're really liking them in addition to their exercises. Because one thing, and we'll probably get into this in a bit, but with the Cadence Original shoes, they allow you to walk smoother without having to lift your leg more, which is the beauty of it. So in day-to-day situations, it makes walking easier. But in addition to that, exercising is also important. And so the consensus in our group has been that the two combined have been really helpful for them.
That's amazing. What do you typically tell people what to expect? And let's start with this first. Who would you recommend these shoes to? Who is the ideal person who should get these shoes?
Yeah, that's a good question because while I do specialize in MS, I work with a lot of people who don't have MS, but they still have drop foot or foot drop or foot drag, foot slap. There's actually so many different names for it, and they're all slightly different. But regardless, it's when the ankle stays down, and so you're scuffing your toes or the bottom of your foot on the floor. So the people that I work with are anyone from multiple sclerosis, even Parkinson's, hereditary spastic paraplegia, rheumatoid arthritis, pinched nerves, just classic orthopedic injury of pinched nerves, and then just weakness in the ankle. So it doesn't necessarily have to be a neuromuscular disease or disorder. If you have weakness with lifting your ankle and whatever causes that, that's what these shoes directly help with, I think.
Awesome. Awesome. Tyler, do you want to chime in? Who did you make them for initially, and how do they work in a nutshell?
I think what Gretchen said is spot on. But answering your question more specifically and who were they developed for, initially, the studies that we were doing at MIT were based on static brain injury. So we were looking at stroke and cerebral palsy. And we were developing that intervention out as something that would provide therapy to retrain the neuromuscular system post static brain injury like stroke. But since we started going with this shoe and we did our beta test, our first test with people before we actually went commercial with this, we were finding that, just like Gretchen said, anybody that had trouble advancing the foot forward would benefit from the shoes. So we started to do little studies with people with spinal cord injury, traumatic brain injury, multiple sclerosis, obviously, brain tumor removal, Parkinson's is a big one. My dad has Parkinson's, and that's been he's been wearing our shoes. So I think, you know, we started to learn after we did our beta test that this is going to touch a lot more people than the ones that we were actually considering at the beginning.
Awesome. Gretchen, how would you recommend somebody get started? So I'm getting my pair, hopefully at the end of the month for those that are waiting. How would you guide somebody to get started with the shoes? I had the pleasure of previewing a YouTube video of yours that's coming up where you're diving into this very deeply, and I really appreciated that. But if in a nutshell, how would you recommend people get started?
Yeah. Do you mind if I do a demonstration?
No,
Or...
please go for it.
Okay. How many people actually have the shoes? By show of hands, if you have your screen showing or video showing. Okay. All right. All right. Some yes, some no. So I'm just going to back up here because it is different than any other pair of shoe or sneaker that you probably own. It's different than anything that I own. Oops, I raised my hand in the thing.
No, you good. That's all good.
And so it is important, I think, that you go about using them in a different way. You wouldn't just want to put them on and go walk about your day-to-day life. It is going to be different. So let me back up here. And never do anything new in a wheeled chair. It's just what I happen to have in my office. So I'm just going to back up so you can see what I'm doing and how I would instruct my clients to work with the shoes. So these are my shoes that I have. I know this isn't the question, but I just want to touch on how easy they are to put on. Absolutely love it. So you're going to un-Velcro, pull the tongue out, and you're just going to push your toes towards the front, and your heel just slides right down. Even with weakness in your leg, it just slides right in. You could always use a shoehorn if for some reason you do have difficulty, but I doubt that you will. And then you put them on and put the Velcro back on. And then once the shoes are on, I like to stay seated, especially if this is your very first time using them. So you're just sitting down, and the way that these shoes work is high friction versus low friction. So for high friction, that means that when you have a lot of weight through your leg, there's a lot of friction. So it's going to be harder to move the shoe. But when you don't have a lot of weight through your leg, so if you lift your leg up, there's very little friction. So it will easily slide. So you got to get used to that feeling first. Otherwise, it's going to feel very weird and bizarre. So what I typically suggest is stay seated. And with one leg, with your stronger leg, take weight off of it. You don't have to pick it up off the ground, but just lift it up a little bit and put your weight through the forefoot of the shoe and allow it to slide around. So go forward, back, side to side, some circles, almost like you're dipping your toe in water to see if it's too hot or too cold, and just let it slide. Then put a lot of weight. So really push your leg down into the floor and try to do the same thing. And you'll see it does move, but barely, because it's high friction. So get used to that, what it feels like sliding and then what it feels like when you have a lot of weight through your leg. Then you do the same thing standing. So go ahead and stand up. If you normally use a mobility aid, go ahead and use a mobility aid for this as well. So you'd have it in front of you, and go ahead and slide it around. All your weight's on this side. Get a sense of what that's going to feel like, especially front and back. And then put more weight through your leg and see how it doesn't really move. Once you got used to that, then you're ready to take some steps. So I'm going to just change my direction here. So once you know what it should feel like, put weight on this leg and allow this foot to slide forward. And then slide on the other side if you need to slide with both sides. If you don't, then with whichever leg is stronger, you can just pick it up and move it as you normally would. But for whichever leg needs the slide, practice sliding as an exercise. I would not just use these shoes, like put them on and go out to the grocery store. I'd use them as an exercise where you're just practicing walking around your room, sliding, using the right technique and feeling that low friction. So that's how I would get started with using them.
That's amazing. Awesome. That kind of answers, well, but let's tackle it specifically, because we get this asked quite frequently. Lisa, a community member, says, a friend of mine received her shoes and they scare her because they feel too slick or slippery or slidey. We've heard this quite a few times. And so I would like you, Gretchen, if you don't mind, to address how, what do you think? You just shared how to get started with them, but what's the adjustment period and what would you respond to Lisa in this case?
My first response would be they're supposed to feel that way. That's how they work. So if they don't feel slippery and nice and slidey, then I think I just made that word up. If they don't feel that way though, then it means that you have too much weight through that leg and they won't slide like they're supposed to. So if you were feeling that, while it can feel scary at first if you're not used to it, it's actually a good thing. That's how they work. But getting used to it is going to be the first step, which is why I usually do it in this order, where you first try the exercises, try the sliding movement seated, try it standing, and then before you even walk around your house and do what you got to do with them on, walk around a room with a mobility aid if you need to, with that technique of sliding so you can feel what it should feel like. As for the adjustment period, some of my members got used to it right away. Like they did that order of making sure they knew what it was supposed to feel like. And within a few minutes, they were good to go. Other people used them just for exercises at first, and it took a few weeks before they felt comfortable using them in other settings. So it's going to be different for everyone, which is the answer most of the time. But I think if you practice it in this way, you'll feel much safer, much quicker.
Awesome. Fantastic. Tyler, what are your thoughts on that?
Oh, I couldn't agree more. Absolutely. The people that I've worked with, I'd say about 70% will just get it the first day and it'll be fine and they'll go on. And the steps that Dr. Gretchen just went over are perfect. I think you want to be able to start to feel the difference. One of the things that someone had said to me at one point was, anytime that you're on a low friction surface, say if you stepped on ice, that low friction surface is never going to change. Your body is used to that low friction just being there forever. And so that makes us really nervous. These shoes are made so that you're going to have that low friction surface, but when you put your weight into it, you start to grip the ground again. And that's where it differs. So for some people, I'd say 70% of the people that I've worked with feel comfortable first day, no problem, get up and go. And I would say that some people take, about 30% of the people take about a week to feel comfortable. So the first day they're like, hey, this is different, this is slidey. But I think if you stick with it and do the steps that Dr. Gretchen just outlined, I think that that's the path towards overcoming that and starting to trust the shoe. When you feel it go from low friction to high friction the first time, then you're going to start to feel like, okay, I can actually trust this shoe. And then it's going slowly and progressing every day. I think once you get those steps down that Dr. Gretchen just talked about, the next steps would be to try to equalize your step length and then try to walk in a more rhythmic kind of a rhythmic way where the timing on the left foot and the right foot are happening about the same time, and we start to try to progress our gait.
Awesome.
I just want to add too, you guys probably know this already, but the pucks are just at the forefoot. They're not in the midfoot. So when you're standing, as your other leg is coming through, you're not even on the slippery part. You're on this part that's nice and rubber. So your stance leg isn't going to feel like it's sliding around as you're bringing your other leg through based on the location of where these are. So just wanted to point that out too.
Good point.
Thank you. That's great advice. A technical question that we often get: what kind of surfaces does it work on? Specifically, community member Sue asks, how does it perform on wet surfaces? And that's probably more of a question for you, Tyler, but Dr. Gretchen, please feel free to chime in as well.
Yeah, so they were made to be used on all surfaces. So that's both indoor and outdoor. If the surface was wet, it's going to reduce the friction of everything. So any shoe is going to become lower friction in that case. So use extra caution if you're on any type of a wet or icy surface, just as you would with another shoe. The one surface that actually affects the shoe the most is rubber. So if you go on like a rubberized track, the rubber will stick to the plastic pucks such that it won't let them slide. And so if you went to say you do usually do your walking steps on a rubberized track, it won't be a good place to do it with these shoes. So I would say, again, if you're over a wet surface, use extra caution. Snowy surface, use extra caution. Rubber surface, know that the shoe is going to perform like any other shoe and you won't get the variable friction over a rubber surface.
Awesome. From that, let's jump into exercising. I thought we got a pretty great question from our community member, Mary. Does using the shoes affect the functional exercises that Dr. Gretchen shows us how to do? In other words, if we are trying to strengthen our foot drop, does using these shoes take away those benefits? So from that question too, of course, now we know how to get started, but if you could speak about exercising and answer Mary's question, Dr. Gretchen.
Yeah, I have gotten this question a lot from my Missing Link members because, so the Missing Link is all about exercising. And now here I am saying, look at these shoes, these are great. And it's kind of the opposite because these shoes allow you to walk with drop foot. Whereas when you're exercising, the goal is to exercise to strengthen and stretch muscles so that you don't have drop foot. So it's almost like they're contradictory. But one thing that I like to remind people is that there's two ways to approach difficulty with an activity of daily living, something that we do every day, like walking. Option one and thing one is to exercise to strengthen your ability to do that. The other thing that we can do is compensate with a tool that can help. And I often like to do both because exercising, as we all know, takes a while. Like it takes a while to reap the benefits from it. There's probably 0 situations where you can exercise in one day and bam, you've got the strength that you need to do what you got to do. So exercising takes a longer time to kick in, but let's say a specific exercise that will improve your walking takes 6 weeks for you to notice an improvement. What are you going to do while you're waiting for those 6 weeks? You use tools to compensate. So I think it's always beneficial to do both, exercise and use a tool that can help. In this case, with walking due to drop foot, it's the tools, the Cadense shoes. And so the answer is do both. You wouldn't just want to use the Cadense shoes. You would want to also strengthen your muscles. And you can do that with or without the Cadense shoes on. So again, let me back up here for a bit. Never exercise in a wheeled chair. It's just the chair that I have here in my office. Okay. So one of my favorite exercises to actually strengthen your ankles so that you can lift your foot up is practicing lifting your foot up. One thing that I always like to say is do the thing that's hard as an exercise. So with drop foot or foot drop, the hard thing is lifting your foot up, lifting your ankle up like that. So we can practice that as an exercise, lifting your ankle up. And if you're sitting now, you can try this. It's going to be easier if you straighten your knees a little bit. So the more bent they are, the harder it will be. But if you straighten your knees a little, and just on one side, maybe your stronger side first, slowly try to lift up your toes. Your heel stays down, toes come up, and then slowly lower. And now go over to your weaker leg. Go ahead and lift up. Now that's, for some people, you might not see any movement. For other people, you might see a little bit movement or a lot of movement. Regardless, this is a strengthening exercise to gain the strength to lift your ankle so that you can lift your ankle right here. When you're walking, you can lift it and move it forward instead of sliding. So you can practice that as an exercise, but you'd also want to practice it while you're walking. And if you use your Cadense shoes, but you are feeling like it's still not sliding, it's hard to get it through, it's because you have too much weight on that leg. So you'd want to practice walking, but shifting your weight onto this leg so that you can lift it and slide it through. And if you happen to scuff, that's okay because you'll slide the rest of the way. So you'd want to practice it as an individual exercise like this. And you'd want to practice it by implementing it into your day. So as you're practicing taking a step forward, you're trying to lift your ankle as you bring it through. But again, that can take a while, especially with MS. It could take a few weeks, it could take a few months, it could take a year. So in the meantime, you've got these shoes that can help out. But that would be a good exercise. Practicing bending your knee is another really good exercise. I'm going to back up again, because when you're walking and you have drop foot, you can absolutely slide, but your knee has to bend. Even with these shoes, you have to be able to bend your knee to get your leg forward. If you don't, some of you might resonate with this, you might swing your hip around or hike your hip up. You might do something funky like that because you can't bend your knee. So exercising in a way to strengthen bending your knee is another really good exercise to improve your walking. You can do it like this with a rollator or something to help you stay steady. You could practice it seated. This is a great one to do with the Cadense shoes because of the slipperiness. You can practice sliding back. The shoe will actually make this a lot easier for you. If that's still too hard, you can practice lying on your bed on your side and bending your knee that way. So there's lots of different positions, but just practicing bending your knee is a really great exercise to help you improve your walking, even with the Cadense shoes. So again, you just wouldn't want to depend on one or the other. You can use them at the same time.
Thank you for that answer. What came to my mind was, if the shoes only make your walking 5% easier, if you can go 5% farther, that's also exercising. Being able to walk more is a great exercise in itself, at least in my mind. So, there's probably inherent benefit in just making walking easier.
Oh, absolutely. And walking is an exercise too. So what I like to do is do these individual exercises as their own part of your routine and implement it by walking. Even if it's just walking around your home or walking to and from the bathroom, that absolutely counts.
Awesome. Let's jump into AFOs. Got a bunch of questions here in chat and also up front. The general question is, does my AFO work with the shoe? Tyler, do you want to tackle that one?
Sure. So the shoes currently come in regular widths and in wide widths. Our wide width is just a standard wide like you'd find in any other sneaker. So the AFOs will work with these shoes if you can get your AFO currently into a regular width or wide width shoe. So if you know about the lasts that are used to build your shoes, that would be a D last for men's regular and an E last for men's wide. The women's are built on C last for regular and D last for wide. So those letters just correspond with the actual width of the shoes. A lot of times, if you have a molded AFO, people need to buy a 4E width or a 6E width. Those widths we currently do not offer, but that is in the works. So again, to summarize, if you can fit your AFO into a regular width shoe or a standard wide width shoe, then these will be could be a good fit with your AFO. Otherwise, they won't. The width won't be wide enough if you currently use a 6E or something like that.
And so I guess to both of you, whoever feels like tackling it, can this shoe, Paul asks, can this shoe be used with an AFO or in place of it? So I guess we answered the first part of it, but does the shoe, or can the shoe replace an AFO?
Do you want me to handle this one, Gretchen?
You go first. I'll go
Okay,
second.
I'll go first. Okay, so this is a great question. So it's going to be a long answer. So we currently are doing a clinical trial comparing the Cadense originals with an AFO. The original intent of these shoes was to be worn without AFO to do a lot of the things that Dr. Gretchen was talking about, which is to strengthen that ankle as you're walking if you have trouble sliding or getting your foot forward. So the current clinical trial that we're now underway with at the Ability Lab in Chicago is comparing our shoe without AFO to AFOs. And we're testing all kind of things like perceived safety level, the effect in terms of on your muscles and your cardiovascular system of using these shoes for an extended period of time versus using an AFO. The real difference here in terms functionally of what's happening is when you use an AFO, you're cutting off movement to that joint. So if you have a static AFO, your ankle will be locked at a 90-degree angle. Now, there's different types of AFOs. There's some that have hinges and things of that nature, but let's just talk about the static one. You are now blocking all that movement. So if you're trying to recover or strengthen your motion, strengthen your joint, you're now blocked. With the Cadense shoe, you have complete free motion of that ankle. So depending on your abilities, wearing the Cadense shoe might be a good answer for you without the AFO, but as Dr. Gretchen said earlier, it all depends on the person. So if you're somebody that absolutely requires an AFO and it can fit with these shoes, I think that you can wear them with the shoe. However, if you're somebody that's training to try to get to improve function, I would recommend trying to wear these shoes without the AFO for training sessions, similar to what Dr. Gretchen does. And then you can put that AFO back on if you're in a situation where you feel uncomfortable.
Yeah,
Awesome.
I have so many thoughts that I want to share, and I'm trying to like sort through them all and which one do I want to share first. So one thing that you just touched on is, yes, it does depend on the person, of course. If you're someone who has zero strength in your ankle, then you'd probably want to wear the AFO in the shoes because, as Tyler said, it blocks movement, so it won't let you drop your foot. With that said, if you do have some strength, it also won't let you lift your ankle. Like it just, for the most part, every AFO is different, but for the most part, AFOs are designed to prevent drop foot by stopping all movement. And if they're great for a lot of people, but if you do have some strength, you want to use that strength. So that's when doing these ankle exercises, the knee bending exercises, using these shoes would be immensely helpful. I can't tell you how many patients I've worked with who actually they got weaker ankles over time because they were using an AFO. So they have their time and place. They are really great tools, but you also want to make sure that you're strengthening and using shoes, things like that, in addition to wearing them. So I'll leave it at that. But
well, I got a follow-up question from community member Barry. Hi, Barry, good to see you. So do you have patients currently that use an AFO with the shoe, and what's their feedback? If you can share that.
Yeah, I'm trying to think if I've heard more recent feedback, because one of the first questions I got was, can I use this with my AFO? So they are using it with the Cadense shoes and the AFO combined. I don't think I've heard feedback since then, so I assume they're using them just as someone who wouldn't wear an AFO. There weren't follow-up questions or like, oh gosh, these aren't working now. So I can only assume that since they didn't come back with more questions, it's going well.
Awesome. Tyler, what about FES devices in conjunction with the shoe? Got two questions separately from Jill and Joe about that. Can you speak to that?
Sure. Yeah. So the FES devices, there's a bunch on the market. The best seller of old was oh my gosh.
Bioness.
Yeah, the
Is it
Bioness system. Thank you. Yeah, the Bioness system. And then now Psionic is starting to take off as a sleeve. And so just so everybody's on the same page, these devices work by shocking the muscle. They apply a voltage to your skin to actuate your muscles. When it does that, you can effectively control the muscles from an exterior source rather than in the neural system internally. So you could certainly wear that with our shoes as a tool that would be redundant. You know, the FES device would be trying to pull your ankle up. The Cadense shoe in that case would be kind of a little safeguard. If you accidentally still come in contact with the ground, you would slide in front rather than clip it, just catching on your toe and then maybe having an incident based on that. So I think you absolutely can wear the two together as just an extra safeguard.
Awesome. Before we jump into, there's a bunch of questions around the weight, the height of the shoe sole, and concerns around that. So I'll address that in a moment with you guys. But quick intersection. So I've been asked, when can we see this recording? It will go live later this week, and we'll send out a follow-up email. Will be on our YouTube channel. And Dr. Gretchen's instructions on how to use the shoes are going to go live on July 21st, I believe. Is that right?
Yep.
Awesome. And then shipping related questions. I've addressed that already. July and September for US-based customers. You know which period of time you've pre-ordered for. For our northern neighbors in Canada, you can currently purchase through our website, through our US-based website. It will add duties to your shipment because we are fulfilling these from our US warehouse. But later this year, I want to say late September, you will be able to pre-order for in-market shipments, meaning you don't have to pay the duty. We're building up our warehouse in Canada right now. We're just catching up on domestic supply, so that's our first priority, of course, and then we'll add more later on. So Canada later this year, and then for all our people that are joining us from the UK, from Europe, you are next in line, as it were. We'll roll out our shoes over in the UK and in Europe at the beginning of 2025. We'll also allow you to place pre-orders later this year, and we'll notify everyone on the list that's waiting. So thank you all for your patience with that. Let's talk about the shoe weight and its height. Gretchen, I'm sure you get this question also quite a bit. How heavy are the shoes? And I'll just say a women's sneaker is 10 ounces. So in my book, fairly lightweight, but what are the particularities around your patient demographic that, why does a shoe need to be lightweight? And what are your thoughts around the weight of the shoe and its height?
Yeah, so with multiple sclerosis, or honestly, with anyone who's on this call, probably, because if you're interested in the shoes, you probably have difficulty lifting your ankle and clearing the ground. So typically with the clients that I work with, but also anyone with this issue, the lighter the shoe, the better, because if it's heavier, if it's a clunkier shoe, every ounce counts when you have MS or this type of weakness. So if it's a heavier shoe, that's just one more thing that's going to make it challenging to lift your ankle and get it up. So generally speaking, the lighter the shoe, the better the shoe. With that said, one concern is if it's too light, is there a lack of support? And when it comes to these shoes, they feel just as supportive to me as any other sneaker that I have. I think they are very lightweight, but that there's no negative side effects with these shoes. I feel just as supported. When it comes to the cushion on the bottom, that's also a hot topic because for some people, more cushion is not good because it means they can't feel the ground as much. So if you're one of those people, if you're thinking, oh my gosh, it looks too high, I won't be able to feel, and when I can't sense the ground or the floor, I don't walk as well. I have been advising my patients to use an insole that can improve your sensation. The company that I know of and like is called Naboso, and I should have had it with me. They have a shoe insole or insert that you can put in, and it has these tiny little pyramids on it. It almost feels like Braille for your feet. And you can put those into any sneaker, and it allows you to feel your feet more. So even though these do have a higher sole, you can still feel your feet more. So for anyone that I've run into that has had that issue, they've used that and they've had positive feedback about that.
Gotcha. So anyone that doesn't have feeling in their feet, as it were, that's a good solution then.
Right. Yeah, because you have to be able to feel your feet in order to walk. If you can't feel your feet, you don't really know where it's going to land. And when it does land, you won't know how much weight of part of your body is through it. So feeling your feet's important. So if you do feel like it's reduced for some reason in these shoes, you can use an insert that can help you feel it more.
Awesome. What do you think about the stability that the shoe provides? Granted, it's height and all. You've walked in them yourself. We get a lot of question of, are they going to feel stable? What are your thoughts on that?
Yeah, I totally get the question because that would be my first thought too, is well, they're lightweight, that's great, but is my ankle going to roll in them? And I haven't felt that at all. They fit just like any other sneaker I have. They're not higher or lower around the ankle. They're about the same, and they feel just as stable as any other sneaker that I have as well. So just because they're lightweight, it doesn't feel lightweight, if that makes sense, in the sense that like it doesn't feel like you don't have a shoe on. They still feel very supportive and stable. It's just not heavy when you're lifting up the leg due to the lightweightness.
Got it. A question that was asked by Diane is, how secure are the shoes when using stairs with the puck slide, especially going downstairs? Have you experimented walking stairs with the shoes?
You know, I haven't, which I will after this call because now I'm curious what they'll feel like, but I envision that it shouldn't be an issue because, again, when we're talking about high friction and low friction, when you have a lot of weight through your leg, it's not going to slide. So when you're putting one leg down, that leg that's being placed down will have a lot of weight through it, so it won't slide. And the leg that's higher up, that's coming down, also will have weight through it as you're stepping down. So I don't envision that being a problem. I'm trying to think, is there a situation where it would be, but with both feet would have a good amount of weight through them where I don't think that would be an issue going up or down.
Tyler, what are your
I can
thoughts?
jump in too on this one.
Yeah.
I've had more experience with this. So I always tell people when I'm coaching them to use the shoes to just use extra caution when you're going up and down, so any type of a level change. So that could be going up a curb from the street, down a curb from the street, upstairs, downstairs. As Dr. Gretchen said, you have to make sure that you get weight on the shoe before you allow it to start sliding left, right, or anywhere. So when you're going down the stairs, use a handrail, get your foot down, get weight on it, and move the other foot. So just use extra caution. I was having a conversation. My dad's visiting from Florida right now, and we were talking about his use with the shoes, and he's like, "Yeah, he's been using them for, I guess, 3 months now. Whenever they were available, I think it was March when he got his shoes, something like that. So 4 months." And he's like, "Yeah, I just keep getting more comfortable with them because I'm just getting used to it." So he's like, "Yeah, he was walking up and down my stairs with my kids, running after them today, with them, and no problem." But I do think in any of these types of situations, level changes, use extra caution just because it's a different situation under your foot until you become a real pro with them. I'd say use caution as you're getting started in all kind of new situations.
Awesome. I want to present this question to both of you. Andrea has got our shoes and she says, I have HSP, hyperextension of my knees, and that's a significant problem. I'm feeling that the shoes are making this issue worse instead of helping. They're extremely slippery and still not comfortable. I'm still not comfortable wearing them. Do you guys have any advice for Andrea? Gretchen, maybe you first.
I'll go first. Yeah. Yeah. So when you have hyperextension of your knee, it's actually due to weakness in your quadricep muscles. So the muscles on the front of your thigh. When those muscles are weak, it can allow your knee to either buckle or give way or hyperextend. And so if you are hyperextending your knee, that already causes a lack of control. So then if you also don't have a lot of weight through that leg and the shoe is therefore slippery, that's even like a double whammy of loss of control. What I would do, of course, I'm a physical therapist, I always resort to exercise, but practice walking and specific exercises without your knee hyperextending, just to train your body to get used to that and to start doing that. And this might sound easier said than done, but also so simple that a lot of people forget this is an exercise. But I'm just going to demonstrate with this leg. If your knee hyperextends, then what you can do as an exercise is practice standing with your knees just slightly bent. And you just stand here as you're having a conversation with someone, just slightly bend and hang out here. You can progress that in lots of ways. You can practice standing in a staggered stance with your knees slightly bent with the shoes on, of course, with both sides. You could practice sliding the shoe forward and back without letting your knee hyperextend. So I'm doing this all really fast, but you'd go slow. Your focus is on not letting your knee hyperextend as you come forward. and backwards. And then finally, you'd practice walking without letting your knee hyperextend. So as you move your leg here, don't let it extend as you bring your other one forward. And you're walking really slow with that focus with the shoes on. So that way you're using the shoes to allow you to move, but you're also strengthening your quadricep muscle to reduce the hyperextension.
Awesome. Tyler, any thoughts?
No, I thought that was great.
No.
Yeah, I thought that was a great answer. Probably the hyperextension, I'd imagine, is happening probably mid to late stance as you're pushing off of the affected leg. That's the time that you're definitely going to want to try to control that. Hyperextension is something that we do see commonly when people have trouble either with their ankles or their hips or they're hemiplegic due to stroke. But everything that Dr. Gretchen just said would make a lot of sense.
Awesome. Can you quickly speak to what kind of materials are used and what kind of life should people expect out of the shoes? When would you generally recommend they replace the shoes?
Yeah, so the materials underneath the shoe, this is just a very high friction rubber tread that's in the center. These are made of nylon plastic. Nylon is about the most wear resistant material that we can use without it damaging your floors. We could get glass fiber infused plastics and things like that, or composite materials, but they would wear away your floors really quickly, and we didn't want that. And then the rest of the shoe is just a standard midsole EVA foam and some more rubber in the back. Well, to answer your question in terms of wear, so if you are somebody who will put a significant amount of weight through the shoe while you're dragging it over concrete, you're going to wear the way of the shoes a lot quicker than somebody that's going to be on carpet or just hardwood tile inside of the house. During our beta test studies, we had people walk in the shoes for 6 months and put 150,000 steps on them, return them. And then I took them apart, measured the thickness, and they were about halfway through the life of the puck after 6 months with that many steps. But how much were they pushing into the ground as they were walking? We've had other people that just really push into that ground, and they're walking 4 miles a day on concrete outside. And they're going to wear the shoes much, much quicker than that because they're just grinding them down. So it's going to depend for everybody. So for some people that are using them mostly indoors, that are just scuffing lightly on every other step whenever it happens, the shoes will last more than a year. The foam is really good and resilient. It pops back, so I don't worry about the foam wearing out. But if you're somebody that's going to be outside on asphalt, crushing it 5 miles a day, where you're pushing into that swing leg every step, it's going to get worn away a lot quicker.
Awesome. And the inside material, do you know what that?
Yeah, so this is the inside material is just a nice knit. We haven't had any wear problems with the inside materials. I haven't seen anything.
LG,
yes,
I don't know who it is specifically, asked, I'm allergic to nylon.
to nylon.
Is the material inside made from nylon as well?
If you are allergic to nylon, I would say I would avoid it because there probably is nylon and plastics embedded in the fabric that's on the inside, some sort of a polyester weave. I don't think it's nylon on the inside. I'd expect it to be more like polyester.
Yeah. Veronica says it would be ideal if we had someone that actually has MS and has the shoes, uses them, tell us how they feel, and how that corresponds with the movements and exercises that Dr. Gretchen is informing us of. We do have a lot of community members that have MS that have left reviews, and you can find that on our review section. But in standing in for your patients, can you share a little bit of their thoughts and how the exercises that you tell them to do, what was their experience with our shoes in conjunction?
Yeah, and before I forget, one thing too, as you were talking about how long they last, is I'm a huge fan of tracking your progress with your exercises. And one thing that you could do is see, get your shoes and see how long do they last before you need to replace them. And then when you replace them, the next time, the next second pair of shoes, do they last longer? Because theoretically, the longer they last, the less you're using the puck to slide your foot forward. So if you're not using the puck as much, that means your legs are getting stronger. So it'd be cool just to test, the second pair, do you get a few more months out of? But yeah, when it comes to my patients who have MS, obviously I can't demonstrate that here. Visually, what I would say, obviously it doesn't look as smooth as what I'm making it look like, because I'm just sliding and bending my knee, and those bending your knees, one of the most challenging things when you have MS. But what I will say is, because they've sent me videos and they've posted videos in our accountability group, it still looks like they're walking with the correct amount of slide. It looks like a smooth walk. It's a little bit slower. Their knee doesn't bend as much as mine, but they're still advancing their leg forward much easier than when they weren't using it. I don't know if that really answers the questions, but it goes along with a question that comes up, which we kind of spoke to earlier, which was exercises versus the Cadense shoes. And some people have thought of using the Cadense shoes instead of exercising. And when you do that, it's your strength just won't improve a whole lot. You're still moving more than you probably would without the shoes. So it is possible to get stronger muscles from the Cadense shoes, I think, but you wouldn't want to just use them in place of exercises, because most people are looking to actually get stronger. And when it comes to MS, it's those exercises of strengthening your ankle lifting, stretching the calf muscles, and then strengthening your ability to bend your knee and lift your leg, so bending your hip.
Awesome.
And Johannes, could I add on to that?
Yeah, please
So
go.
if
Go
people
for it.
wanted to hear a good testimonial, on our website, if you were to click on, you hover over adaptive shoes and then you just click on shoes for MS. The third video, it says Chad was on there. Chad was one of our beta testers. So he wore this shoe before it was a real product. And he wore it for an extended period of time. You can see him walking before and after the shoes, and you can listen to what he has to say about it. So this was before we even decided to go to market. We were trying to assess, is this a safe product and will this help people? And he was one of the first people that told us, you guys should go forward with it.
Awesome. And I am seeing Lolita in our group here today as well, and she's got the shoes, and I believe she's on that page as well. So lots of good testimonials from our MS community on our site that people can view. One question before we do parting thoughts: how is it to drive with the shoes? That gets asked quite frequently. What are your thoughts, Tyler, on that?
Yeah, so I've driven in them on purpose to test that, and I have no problems with it. The bottoms are low friction here on these slides, but there is that piece in the middle. So when I'm driving, if the pedal's here, I always just have my foot tilted. I drive like this, my foot's down, I tilt on it, and I get that high friction patch right on the pedal. It doesn't actually inhibit me at all. However, our official stance on this would be use extra caution when driving. Test it out a bit before you do it without the car on, just to make sure that you feel comfortable on that gas pedal and on the brake pedal before you actually go ahead and drive with the shoes. We have been asked this question a few times. That's why I started driving with them, just to see how I felt. I know other members of our team drive with them too, just so that they can also assess how they feel with it. And we haven't had any real complaints with that yet.
Awesome. Well, with that, I'm going to round it up. Dr. Gretchen, thank you so much for joining us. Where can people find you?
Yeah, of course. Thanks for having me. The best place to probably find me in all locations is my website, which is missinglink.com or msinglink.com. I have a book called The Missing Link. I have social media accounts. My Instagram is dr.gretchen. I have YouTube videos, and you'll be able to find all of that from my website. And then my podcast is also called The Missing Link. So if you search my name and/or The Missing Link spelled in that way, you should be able to find me pretty easily.
Awesome. And we'll put it in the show notes as well. Any parting thoughts from your end on the shoes? Anything that you want to say to the community here?
I guess my final thoughts would be, I'm so grateful that something like this was created, because for so many symptoms of MS, there are tools out there that can help. Even just thinking of, something for the, upper body. Let's say like washing your hair can be really hard if you have arm weakness. So there's exercises that you can do to strengthen your upper body to wash your hair. But if you aren't able to get that strength right away, there's products to wash your hair, like extended brushes and whatnot. But there hasn't been anything like this. Like AFOs have a completely different purpose. Um, other braces do as well. So I'm just really excited that this product, these shoes have launched, and they go so well with exercises. And so I think as long as everybody is able to do both, these shoes can allow you, I feel like I sound like I'm a sponsor. These shoes can allow you to exercise more effectively so that you can walk better. So I would just encourage you to keep up with your exercises, keep moving. These shoes should allow you to do that.
Awesome. Tyler, any thoughts from your end
I
before
just
we
thought
wrap
it
it?
was really fun having Dr. Gretchen here and to answer all the questions from a physical therapy standpoint. I'm an engineer, so I thought it was really interesting. One of the things that Dr. Gretchen said that just jogged my memory of something that happened in our pilot tests when we were still cutting holes into shoes at that point. It was before the era of the beta tests and actually having something that looked like a real shoe. But we cut holes in shoes and we were putting these low friction elements inside. And one of the first people to walk in that type of a shoe, she had MS, and she said, I have a video of this, and she's just like, oh my God, I can use my knee can bend again. That's like Dr. Gretchen, she was talking about taking her foot and doing something like this. This particular person had MS, and she had just a really difficult circumduction type gait, and she kept her knee pretty straight and rigid at that point. So with these shoes, it was the first time where she was able to come forward. And she's like, oh my God, I can involve my knee again. I can bend my knee as I was walking. And so that just jogged my memory, and I thought it was a fun memory to share. But anyway, thank you
Awesome.
for everybody for joining us.
Yeah, thanks everyone. Thank you. We'll wrap it up at this point. We'll let you know when the next Q&A goes live. And Dr. Gretchen, thank you. Good seeing you as always, and we'll be in touch.
Good seeing you. Thanks for having me.